Since yesterday, we have confirmed 107 new cases of COVID-19 in Alberta. This brings the total number of cases to 1,075. Of these, 196 people have now recovered, which is 22 more than yesterday. We suspect 137 of our total cases may be community transmission, an increase of 29 from yesterday. Sadly, as you heard the Premier mention, I must report 5 additional deaths related to COVID-19, including 4 at the Mackenzie Town Continuing Care Centre in Calgary. There are now 8 deaths related to COVID-19 at this facility. Today's reported deaths also include a woman in her 20s from Edmonton. It is not clear at this time whether she had underlying health conditions. This is a tragic reminder that it is not only the elderly or those with underlying conditions who are at risk. The measures we have in place are to protect all of us. I want to say that I have heard questions about whether we should try to let spread happen in young and healthy groups to increase our population's immunity over time. I completely understand this question, but the problem is that we don't know who will have a severe case of this disease. Some people who are young and healthy will go on to have severe disease and even die. So until we have more information about who may be at the greatest risk and more evidence about treatments, the best way to prevent severe illness is for all of us to perform physical distancing, to stay home when possible, to avoid non-essential activities. To limit further deaths, we must all follow public health orders. There are many grieving families in our province today, and I extend my sincere condolences to each and every one of them and all the loved ones of those we have lost. It may appear we are seeing a spike in the number of people infected in the last few days. What we are actually seeing is the excellent work of lab services to work through a backlog of swabs that were waiting to be tested. To be clear, we continue to see ongoing new infections, but the sudden increase we have seen recently represents the date the lab completed the test, not when a person became ill. One of the most important numbers we have been tracking all along is the number of new cases we are seeing who don't have a link to another known case. We have called these community-acquired. Although we have announced additional cases in that group over the past few days, what I can tell you is that when we look at the number of these cases by the day the swab was collected, instead of the day the lab tested the swab, we are seeing that our new daily numbers of community-acquired cases have remained relatively constant over the last 10 days. Every one of these cases is concerning, and we follow up with every case to ensure that we are limiting spread. However, it does not seem at this moment that we are seeing a rapid rise in local transmission. We will continue to closely monitor these numbers. Our collective work to flatten the curve is more imperative than ever. The world learns more every day about COVID-19. Someone asked me yesterday when this will end. We cannot say for certain, but we should expect that we will be responding to this infection for many months. One additional preventive measure that Alberta Health Services is putting in place today is limiting visitors to hospitals. With few exceptions, patients in hospital will no longer be able to have any visitors in person. Please plan to support loved ones in hospital with virtual visits instead. We are continuing to watch the situation in our province very closely. We need to move forward together, even though we are physically distanced, to ensure we take care of each other during this time. We know that masks can limit the spread of infection from a person who is infected to others. We also know, as I've said before, that a small proportion of people who have COVID may spread the virus before they have symptoms. And so it is certainly something that, again, in general, wearing a mask would be more protective for those who are wearing it. It would protect others from those who are wearing the mask rather than protecting the person wearing it from others. So in that vein, I certainly think that masks can be considered. The challenge with cloth masks, and I haven't seen the CDC summary of evidence, I've just seen our provincial summary of evidence. The challenge with cloth masks is understanding whether those cloth masks do as good a job as surgical masks in preventing the spread of infection. And so we know from some studies that when cloth masks get damp, so if someone wears them for a long period of time, they actually can start to trap virus and they could be a risk for the person wearing them. And so that's why I've asked our team to look very deeply at all available evidence, because what I wouldn't want to have happen is for people to start wearing cloth masks and inadvertently, therefore, expose themselves to more risk, when what we want to do is lower the risk more broadly.